Hello and welcome to Lancet TV. I'm joined by Professor John Strang from the National Addiction Centre at King's College London. Welcome, John. Now, your paper looks at the effectiveness of interventions. Why did you choose to focus on this particular area?
There's a crucial need for us to bring the scientific discipline to consideration of the field. Of course, there are all sorts of opinions out there in the general public and in the political realm about what we would like to be the situation, but what we as scientists can bring is a rigour about looking at where do we have actual evidence of either effectiveness or leverage on the problem. Society itself then has to make decisions about what mix of interventions it wants to have, but we want that debate and that discussion to be informed by a good understanding of which interventions are likely to have a large or a small influence.
And in brief, what were your key findings?
Well, we looked at 5 different domains, so that's across international drug control and then domestic drug control. We also looked at regulatory frameworks, we looked at prevention, and we looked at treatment and rehabilitation areas. And we found very different levels of evidence and very different power of those interventions in the different areas. So I could tell you about where we were struck by the powerful interventions and also by the weakness of the interventions.
So what were the most powerful interventions?
The most powerful interventions seemed to be in the treatment and in the rehabilitation domains, and I'll pick out 3 as illustrations. And these are not evenly across all drug problems. So with opiate substitution treatment, so that's things that are popularly known as things like methadone maintenance or buprenorphine maintenance, they've been very controversial, but the advantage of that is they've been very well studied. And so we've now got strong evidence of their ability to help people to quit their street heroin use and to move towards becoming abstinent, their health and well-being improving, quitting crime, quitting injecting, and beginning a journey of recovery. And we've got that evidence across different countries, different cultures. So that's one of the first conclusions. The second area would be around 12-step or self-help group recovery. Until the last couple of decades, that's been not at all well studied or well researched. But the good news from the scientific community is in the last couple of decades, we've got good quality studies which now improve our understanding of it. Clear benefit with strong advocacy and a hugely valuable resource for people in their recovery. And we'd anticipate further improvements with the mix of research alongside practice in the years ahead. And the third area that I'll choose as an example is the public health example around needle and syringe exchange schemes, enabling people to modify the severity of their drug problem. So we obviously wish they didn't carry on injecting, but this is a public health way in which you can reduce the risks of HIV or hepatitis B to the well-being not only of those individuals but society at large.
And what did you find were the least effective?
It'll probably be a surprise to quite a number of listeners to find that the prevention area was very disappointing. It's quite a substantial part of our investment as society, and from a science point of view, the good news is we've now got strong studies that have examined that. Unfortunately, the conclusion is that the strong evidence is of very little effect on actual drug-taking behaviour. So there are 2 areas in which the prevention field is likely to be developing more productively. One is around perhaps more engaging and interactive individual prevention work rather than the notion that you can deal with it in a mass classroom setting. But the other is through screening and brief interventions, that even though the impact may be quite small, they can be so easily and widely applied that there can be a huge amount of benefit. And probably the other area of real disappointment in terms of the effect size has been in the international initiatives. So areas like crop substitution, in the belief that it will alter the price and availability in a final market country. We couldn't find any evidence of any sustained impact on the availability and price from that considerable investment in those efforts. Price seemed to us to be an important issue. This is quite an influence on both legal and illegal products being used, but trying to influence price in producer countries seemed an inefficient way of achieving it.
What about the effectiveness of criminal justice?
Yeah, no, that's an important area, it's one that's currently in development, that what we have is an interplay between the criminal justice system and the change or the treatment system, sometimes involving treatment, sometimes not. And perhaps one of the particularly interesting areas is around drug courts. Now, the data are only coming out at the moment, so it's too early to make a sort of firm conclusion on it. But it looks very encouraging that the key features are that you have a very prompt attendance at court. That day, there's an actual consideration of your case, and the actual the punishment or the penalty may actually be very mild, but it's certain and it's immediate, and your future contact with the criminal justice system depends crucially on how you then comply with the conditions attached to you. And the immediacy of the very modest penalties seems a much more effective way of influencing behaviour than the notion of a draconian sentence that might be a year or two later. And when one looks about it from human behaviour point of view, that's what you'd expect.
In the light of your findings, how would you like to see drug policy develop in the future?
The single most important change we'd like to see is that the public debate and the political decisions should be better informed by an awareness of what science can tell you. It's not for scientists to say what drug policy should be, but scientists can contribute an extremely important perspective on what is the best you could expect to achieve by pulling on one lever or another lever. And at the moment it's far too influenced by advocacy or aspiration and just a wish for what would happen. The balance between prevention and active intervention is a good example, and it applies across the whole of the health sector. Of course, one would like to have more powerful preventive methods. You've then got to stand back and say, and do we have any evidence that those preventive methods actually exist and will deliver what we'd like them to deliver? That's where science can come in and say, we can look at the worldwide evidence and we can tell you what is potentially deliverable, and it also allows you then to measure yourself against that international standard.
Thanks very much for joining us.
Okay, thank you very much indeed.